Good evening, everyone. I'm Leah Cooper with your JCN News for this Friday, August 28th. The Ministry of Health's increasing hospital bed capacity, testing capacity in labs, and fast-tracking repairs and upgrades to public health facilities in New Providence and Grand Bahama. This coming from Health Minister Wenwood Wells at the ministry's weekly COVID-19 update today. The minister adds that this is a part of a comprehensive COVID-19 response strategy to meet the significant demands placed on the public healthcare system to ensure the well-being of all Bahamians and residents.
For the COVID-19 response, there are 10 beds at South Beach Urgent Care and Referral Center, 16 beds at the Cancer Association of the Bahamas building in Freeport, Grand Bahama. 4 beds are available in the Legacy Unit of the Princess Margaret Hospital, 10 beds in the Old General Practice Clinic in PMH, 18 beds currently available at the 62-bed National Response Facility at Super Club Breezes Resorts, 21 beds at Doctors Hospital West, 5 beds at Doctors Hospital East, and 30 beds are expected to come on stream in short order following the relocation of boarders from the Princess Margaret Hospital.
That's 114 beds added to the healthcare system. The minister adds that yesterday, he and Prime Minister Dr. Hubert Minnis had the opportunity to tour the 62-bed facility that will be used to expand capacity to care for COVID-19 patients in the east wing of Super Club Breezes.
Patients will experience soothing oceanfront garden views that can boost mental health. 18 patients can be accommodated on the first floor and 22 patient rooms each on the second and third floors. Each floor has a lounge for nurses and a lounge for physicians. Staff accommodations are on the 4th floor. This makes it possible for staff members to isolate effectively and avoid the potential risks of taking the COVID-19 virus homes to their families.
As part of this strategy, Mr. Wells says there's also a plan in place to relocate boarders at the Princess Margaret Hospital, adding that 2 adult males will be relocated to the Persis Rogers Home for the Aged, 26 at Pat's Senior Home, and 2 individuals will eventually be transferred to the South Andrews Group Home. Now, as it relates to testing COVID-19 samples, the minister says this.
Thanks to the Pan American Health Organization, the National Reference Lab can run 2 sets of 96 samples per day if the samples are prepared with the requisite support. Staff at the National Reference Lab, with the help of volunteers, have worked 18 to 20-hour days to eliminate the previously reported backlogs. We have validated our data to ensure that we are well aware of where we are in this second wave. Currently, there are 2 gene expert machines and 1 Panther fusion system being used at Princess Margaret Hospital to provide diagnostic RT-PCR testing for COVID-19 virus.
Mr. Wells notes that between the 14th and the 27th of August, the Princess Margaret Hospital lab has performed 794 RT-PCR tests on COVID-19 samples. He adds that $21 million has been allocated for the phased redevelopment for the Rand Memorial Hospital over in Grand Bahama, which was destroyed during Hurricane Dorian last year. The first phase is set to be completed on September 29th. That phase covers the main entrance, foyer, pharmacy, admissions, and pediatrics. The minister says that phase is 80% completed. COVID-19 cases here in the Bahamas surpasses 2,000 as the Ministry of Health late last night announced 97 additional confirmed cases with 2 more COVID-19 deaths. Health officials confirm that those 2 unfortunate deaths are under investigation. These deaths bring the COVID-19 death toll to 50. As for the additional cases, health officials confirming 82 cases in New Providence, 6 on Grand Bahama, and 9 with locations pending. The country's confirmed cases now stand at 2,020. There have been 1,218 confirmed cases of COVID-19 in New Providence, 543 in Grand Bahama, 67 in Abaco, 53 confirmed cases in Bimini, 19 in Exuma, 15 in the Berry Islands, 8 confirmed cases in both Cat Island and Inagua, 5 confirmed cases in Eleuthera, 4 in Acklands, 2 in Crooked Island, 1 in Andros, and 77 confirmed cases with locations pending. Active cases now stand at 1,221, with 82 of them hospitalized. Recovered cases are at 742, and 10,625 tests have been completed. Opposition leader Philip Davis has been discharged from the Emory University Hospital in Atlanta late last evening. This coming from Progressive Liberal Party Chairman Senator Fred Mitchell. On August 16th, Mr. Davis announced via voice note that he had tested positive for COVID-19 and was admitted into Doctors Hospital. Then on August 20th, the opposition leader traveled to the United States as he said his daughter was a senior doctor there and wanted to keep a close eye on him. Mr. Mitchell denounced rumors that Mr. Davis entered the United States on a special agreement.
The F&M trolls and scum, you see, were busy during this period, trying to sow seeds of discord, making up one lie after the next over Philip Davis, saying that he had to have special arrangements to enter the U.S., but he entered the U.S. as an ordinary Bahamian citizen, and there were no special government-to-government arrangements necessary for the visit.
The chairman also spoke about the breaches of privacy Mr. Davis has endured during this time.
The visit was private and personal, and the medical profession in this country ought to examine itself, so should the insurance companies, about the shocking breaches of privacy with regard to Mr. Davis's personal health matters. Stuff like this, stuff that ends up in the newspapers, in my view, should be criminalized. And then, of course, this persistent lie about these special arrangements that have to be made for him to travel to the U.S. Just one lie after the next. It ain't so.
The PLP chairman assured that Mr. Davis is feeling much better and that he was very grateful to the many Bahamians of goodwill who sent prayers and best wishes, and says the PLP leader looks forward to returning home. And toiletries, clothes, and food presented to Prime Minister Dr. Hubert Minnis and Health Minister Renward Wells yesterday at Super Club's Breezes. Presenting the toiletries and clothes on behalf of Super Club's Breezes was its managing director, while Operations and Business Development Manager of Grace Kennedy Services, Lovie Jean, presented the food donation on behalf of a partnership between Grace Kennedy Money Services and Grace Foods. The Prime Minister and the Health Minister accepted the donations on behalf of the Bahamian people. Following the presentation, Dr. Minnis and Minister Wells toured the resort, which has been transformed into a care facility as it was identified as a national response facility to accommodate mild to moderate patients under investigation for COVID-19 by the Prime Minister earlier this month during his national address. Also on hand for the tour was Chief of Services, Accident and Emergency Department, Dr. Krista Wells. There are approximately 60 beds for patients. Super Club Breezes accommodates both the employees that are attending to the patients on one floor, and clinical and management operations on other floors. You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.